Kaya, I'm Della Morrison and I'm happy to introduce Nathan Riley from Derbarl Yerrigan Health Services. Nathan, can you tell us a little bit about yourself and your role at Derbarl Yerrigan Health Services?
Yeah, sure. So I'm from Narrogin, so that's where my family are, the Riley and Yugal mob there. We grew up in Condon, me and my siblings, so I'm one of 6. It's a big family, so we grew up in Condon, Beverley and Perth metro area. So I started my studies in health, first at Marn Woodage, Marn Woodage training. I started in nursing first, then I moved into nursing at ECU in Joondalup. From there I was working in the Children's Hospital as a nurse, and then I moved from paediatrics into Derbarl Yerrigan Health Service as a nurse. And then I just really had a good passion for health promotions, because I feel like our mob, we need to understand healthy lifestyle choices and understand the importance of it to our health. So got into health promotions. I'm the health promotions coordinator at Derbarl. I've been in the position since probably March this year, and it's been a learning curve and a great learning experience for me.
That's a huge responsibility for a young man.
Yeah, it's a bit daunting at some points, but having the support of the health service, the staff, the clients, the community, really great support. We do, as an example of what I do and the team that I coordinate, we do prison visits on education, on sexual health, talk about the services that we offer. We do school visits as well, workshops, programs in collaboration with other services, so like Cancer Council, Diabetes WA. So we do quite a lot and assist with community events as well.
What service does the health service offer and what role does it play in the community?
Right, so Derbarl Yerrigan Health Service, we offer many services such as primary healthcare. So doctors and nurses, dental, we have a dental service. Most mob in Perth know that, because they're all trying to get their appointments in. We have a social emotional wellbeing, so made up of psychologists, counsellors, ALOs and other specialists. We have a child maternal health team as well, and we have visiting specialists. So we have a lot of services that mob probably don't know that they can access, but they are available, and the importance of that is quite a lot in the community, because we want to look after Perth Metro Aboriginal mob, but also transit mob from up north or from over east, so we really want to cater for that, all of them.
Why is it important to have a health service that caters to the Aboriginal community?
It's very important because we want to tailor our services to the specific medical needs of the Aboriginal community. So as an example, like if clients are coming in for appointments to see their doctor, we would really want to support them from the start to the end, and that could be from a cultural approach. So that's from our transport officers picking them up, bringing them in, having that quick yarn, not having that where it's all like medical in regards to like those white rooms where you feel like a bit anxious and stressed. So to when we leave, so when the client leaves. So we're quite supportive, and hopefully that will gain a sense of trust between the Aboriginal community and the health professionals.
And what does it mean to provide a culturally appropriate service?
Well, it means a lot. I think it's very important to provide that, because we want to, as an example at Derbarl, we always go to our elders, for advice and guidance when it comes to anything. So having that common ground and that middle section where we can have medical terminology and medical, science coming with, cultural aspects. So coming together where we can hopefully help the Aboriginal community a bit more. So that's, women's business separate to men's business, and having just the understanding on how to ask questions about women's and men's business. So just having that understanding.
Fantastic. That's really important in our community, isn't it?
Very important.
And what messages do you have for the Aboriginal community about COVID?
Well, so, there's so much people's opinions on it. I think myself, I was a bit shocked at first as the health, in the health profession. But, I got my vaccine, my family got their vaccine, and, we usually had COVID yarning groups. So we invite, the community to come in and have a yarn with a doctor, and also health professionals, so the nurses as well, in regards to, the breaking the myth busting kind of questions out there. People are saying that there's microchips in them. There's crazy stuff like that, and we really want to, cut that out, the negativity from it, and try to, protect our mob and protect the community, especially, as it's horrible to say, as an example from over east. It's crazy over there. WA has been quite great, but we really want to protect our mob and our community, especially with our, illnesses, chronic and acute, for sure.
Okay. Oh, that's great. Thanks, Nathan, for your time today.
Thank you.